The overhaul of the nation's healthcare system has focused a bright spotlight on what hospitals charge insurers, Medicare, and patients who don't have any medical coverage for certain procedures. And the results are startling. The data shows different hospitals often charge vastly different prices for the same procedures. Hampton Pearson has more on the massive discrepancies in cost and how they may impact your premiums.
Call it hospital sticker shock. First time ever government data on the huge gaps in hospital charges for the same procedures nationwide. 2011 data on what 3,300 hospitals billed Medicare for the 100 most common procedures, all now in a massive database that consumers can access. No comment from the hospital industry, but the Obama administration says it's the kind of transparency that could be a game changer when it comes to lowering hospital costs.
The history of marketplaces is that transparent marketplaces are more competitive, and more competitive marketplaces drive down cost, and that's certainly the hope here.
A few examples. A hip replacement costs $321,000 at a medical center in Upland, Pennsylvania, but just over $20,000 at an Akron, Ohio orthopedic facility. Treating a heart attack costs $210,000 at a medical center in Pennington, New York, but just under $7,100 at the Huron Medical Center in Bad Axe, Michigan. The bill for gallbladder surgery topped $150,000 at a medical center in Bayonne, New Jersey, but just over $5,100 at a hospital in Danville, Arkansas. Most patients don't get hit with the full bill because they're paid by either government or private insurance, who negotiate lower payments. But those wide-ranging costs are reflected in premiums.
The data is very clear. Premiums track directly with the underlying cost of medical care. So as the cost of providing care increases, as the prices increase, that's having a direct impact on what consumers and employers are paying for healthcare services.
The government sees businesses and consumers using the information to make better choices and put pressure on hospitals to lower costs. For Nightly Business Report, I'm Hampton Pearson in Washington.